I think the value that they bring is very high. I think it's the place to go outside of the general meeting space to get information on products that we use on a daily basis or that we will be using on a daily basis as new things come to market. So I think having that opportunity to meet with them and to interact with them is really kind of crucial to the whole meeting. I think what the exhibitors need to do is to make sure that they're offering something more than what they do on a daily basis as they go out to physician offices and meet with docs outside of general meetings. And I think the things that add high value are the things that I can't get every day. So that's an opportunity to meet really with the people who can talk about high-level science and other physician leaders who are world-renowned experts who can really provide just a level of information, a level of discussion that I can't get from my day-to-day interactions with pharmaceutical companies. I think if I knew in advance that a particular exhibitor had a specific expert who was going to be available for questions or available for a presentation with a Q&A session afterwards, if I knew that in advance, I think I would make the effort to go and spend time there and interact at that booth and with that person. I'd like to see more on the technology side. So things that can be demonstrated to me, whether it's software programs, whether it's medical equipment and imaging equipment like thyroid ultrasound, whether it's bone density imaging equipment that can be demonstrated in a real-life way in front of my eyes. That to me is something that can sometimes be there, but I think can be highlighted more and emphasized more. And that to me, again, is something that I feel would catch my attention, that would draw my attention, that would draw my interest in going to see, to making time to go see, and to spend more time with those people. Because again, that's something that I can't get every day in my office. I want to have access to journal articles that they think are relevant, that they can share with me. And I want to have access to other sources of information, whether it's a literature review or other resources that can help me to read on my own time, to give me additional information on a particular product that they're selling and to understand it really in a broader context, not necessarily just about their product, but about a class in general, the science behind it as it relates to the particular disease that we're talking about treating. I really don't want to talk to a salesperson. To me, a salesperson is someone who I can see on pretty much any day, throughout the year. What I want to talk to a science person. So to me, the person that's most important to talk to is a medical science liaison or to a physician director of clinical research at that particular pharmaceutical company, because I feel that they're the type of people who are able to provide me with non-biased information. I don't want a sales pitch. What I really want is to leave with a better understanding of the science, and I want to leave with a better understanding of their product. But I don't want to feel that pressure of having to prescribe a product. Really, to me, it's about getting that extra knowledge and getting it from a source that I feel that can be neutral as we talk about the pros and cons of any particular drug. I want to leave with knowledge. I want to leave with even questions in my own mind that I can go back home and think about in terms of doing some more research and looking up more. So I want information on relevant literature that I think can help improve my understanding of topics. And I want to leave with really a broad-based understanding of what other resources may be available to me so that I can really have a comprehensive understanding of a disease and of a treatment for it.